Welcome to the KiDDS Biz Podcast, your go-to source for unlocking the secrets to success in orthodontics and pediatric dentistry. Each episode, we bring you expert guests who share innovative strategies and insider tips to help your practice thrive. Whether you're looking to enhance patient care, boost your marketing, or stay ahead of industry trends, we've got you covered. Join us on this exciting journey to elevate your practice and make a lasting impact in the lives of your young patients. Let's dive in.
All right, welcome back to the KiDDS Biz Podcast. Dr. Ashley,
Yay.
great to be with you.
I am so happy to be here again. What is this, like the 7th episode?
Something like that. I mean, I'm starting to lose count.
We're making headway.
Yeah. Hey, I am so excited to introduce Dr. Carter. We had her on a couple of episodes ago with Dr. Joel Berg, and we had so much great feedback from that conversation that we wanted to have her back and kind of dig a little deeper into all things ortho peds practice and just get into the weeds a little bit. So
Absolutely.
So Dr. Carter, welcome back.
Thank you. To be back.
Yeah. Well,
so I know that we were all talking about this a little bit earlier, but I feel like, there's no true consultant that knows pedo ortho in and out and how to make them efficiently run together. I feel like there are consultants out there that specialize in ortho and then can give you some pedo recommendations and vice versa. So, not that I know everything. That's why we have Christina on here as well. But I feel like this could be like a really good, like mini residency, an hour, like jam packed of like actionable takeaways, for anyone that's maybe even starting at pedo ortho, thinking like, oh, I kind of see this trend. Maybe I need to add pedo to my ortho or add ortho to my pedo. So I feel like this is going to be a really great conversation. I'm very excited.
Yeah. Dr. Carter, for those that might be listening to the first time and didn't catch the last episode, would you mind just kind of giving a rundown of, you have a very impressive resume, so I'm not going to even mess it up. I'm going to let you just handle that.
Yes, I do a lot. I'm tired. I am a board certified pediatric dentist. I am an orthodontist, and I did a fellowship in cleft, craniofacial, and surgical orthodontics. And I practice all three in my private practice in Madison, New Jersey, which is about 22 miles southwest of Manhattan. And in my 2,500 square feet, we do a lot of pediatric dentistry and a lot of orthodontics. And we really help our patients and our parents and everyone, basically. And I have an associate who's fantastic, and it really makes life so seamless and so wonderful. And it's really the best way to practice as far as I'm concerned.
I love it. Yeah, you're a busy, and you do some education stuff. I mean, you're all over the place.
But I'm involved in organized dentistry. I have my certified therapy dog who comes in the office too, which definitely makes everybody happy on days that she's in. So it's fun.
And maybe we can even touch on that a little bit too, because we have a dog. So that's
Same
the
dog,
dog
I
that
think.
that was just, is it a Cavapoo?
She's a toy poodle.
Toy poodle. Okay.
Everybody Cavapoo. Mm-hmm.
Yes, yours looks just like ours.
Looks like it's there.
Yes. And like it is, you will have the 1% where he has to go away and, there's some fear or whatever. But 99 out of 100, the kids are so disappointed when he's like has a day off or has to get groomed or something like that. So I really feel like having a dog has been very integral into like our pedo ortho, just to make everyone feel so comfortable and at ease.
Absolutely. My team is happiest on days she's there.
Yes.
My patients are happiest. It's really adorable how she just snuggles up on the chair with them, and it just changes the whole mood. Just
How many years have you guys had a dog?
12.
12. Oh my gosh. Okay.
Same dog?
Same dog.
Whoa.
Oh, wow.
How
Wow.
old's Peanut, Ashley?
Peanut is 3. We brought him, so he started going to the office at 8 weeks old immediately when we got him. And it wasn't like my master plan to have like a therapy dog. I was actually very hesitant about it in the very beginning. I feel like all of a sudden, at least in our area, or I just see on Instagram, that like everyone's getting a therapy dog all of a sudden. But when I decided to bring home Peanut, I was worried that like patients were going to like, we both worked full time. So like leaving him at the house wasn't an option. And so I was like, well, we're just going to make it work. And I was like scared like people were going to think that it like wasn't hygienic or, just have mixed feelings about it. And so it's been the best thing ever, but it was not like I didn't get him for the office by any means.
So did he need to be like certified therapy and pass tests and all that?
Well, we did that after the fact because I was like, some person is going to come in here and want documentation or, so there's going to always be an outlier. And so we went ahead and did all that after the fact, but it was like not, I didn't get him for the office, if that makes sense.
Yep.
So Christina, did you have a plan to have a therapy? Like, did you plan it out that way, or is it kind of like Ashley's situation?
My thing was, if I'm going to get a dog, I want it to be a therapy dog. So I knew I wanted a small dog. I knew that I wanted it to be hypoallergenic. I didn't want like hair and slobber,
Yes.
Like big dogs are. I just couldn't be walking around with a roller all the time, getting the hair off me. And it turned out that the poodles are really great with it. And when I got Callie and I was doing my dog training with her, without me saying anything, everyone said she would make a great therapy dog. And I was like, that's an interesting thought. So it wasn't the plan, but it was in the back of my head.
I love that.
Things happen.
There you go. There you go.
There's someone I follow on Instagram, and I'm going to like say it incorrectly, but I think it's called Paw Sensitive. But basically she did a startup and she's just pediatric dentistry, but she like themed it all around her dog. Like he's like, cause we always say, oh, Peanut's our mascot. And like kind of retroactively we did that. But truly as the startup, like it is all about, we have a therapy dog and, that is like the cornerstone and branding of our office. And I thought that was super cool. So we've kind of chatted a lot as she was doing her startup about having a dog and what that looks like and everything. So that was fun.
With that is at a certain point, you need to have a retirement party.
Yes. Oh my gosh. I've literally thought about that. I'm like, if something happens to Peanut, like I would have to have a funeral for this dog at the office.
Shutting down the office for a month. Like,
Yes.
Well, you're not thinking about having a retirement party for Callie,
Oh,
are you?
no.
Okay.
Just 12 and very spry. And in fact, I have 2 different parents in the practice who are vets.
Okay.
And every time you heard, they're like, what is she, 7, 8? And they, and I was like, no, she's 12. And they are shocked. And the one thing they say to me is, well, the 2 things they say to me is keep doing what you're doing and make sure you brush their teeth and get them cleaned, get the teeth cleaned. And now that when she was 11, I brushed her teeth at 11. It was the first time they said, all right, we need to go in and do a professional cleaning. And apparently about age of 10, small dogs start getting more buildup.
Mm-hmm.
And so 11, we had our first cleaning. And then at 12, they were like, we should probably do them annually because it's the teeth that bring down these dogs. And that is going to be the reason that my dog goes down. Honestly.
That would be ironic.
Yeah, exactly. I'm the authority on little teeth and we're going to make it on these little dog teeth,
Yeah.
You mentioned earlier what the dog has even done for your staffing.
Mm-hmm.
And, I feel like everywhere everyone talks about the qualms of their office and it's, staffing is an issue. We have a ton of turnover, especially being a startup during COVID and just getting like a really great team together has been very difficult. Peanut is like such like a selling point for, for new staff and to keep the current staff happy. And so let's kind of talk a little bit about staffing in your office. So is everyone like dual trained? Like for me, I feel like when I'm hiring, maybe that's why it's so difficult is because in our office, they have to want to be dual trained. There's not an option to be pedo or ortho. They have to do both. And so maybe they may not want that. How do you do that? Because I definitely feel like that's been hard on our hiring situation.
Everyone is dual trained in my office.
Yeah.
Now, my primary ortho assistants are stronger at ortho than my primary peds assistants.
Right.
And my assistants are stronger at peds assisting than they are at ortho, but they can both do almost everything. My hygienists are fluent in both. They do lots of different things, and they are fantastic. And they actually enjoy doing the ortho side because they're not just cleaning teeth all day long. And
Right.
so
what do you have your hygienist do on the ortho side?
So if they're doing a cleaning and then they have an adjustment, they'll, instead of taking out wires, like they'll take off the ties, clean, and then tie them back as an adjustment, so they all of that.
Do you have them just retie, or like, are they capable of like doing a full adjustment? Like
yeah.
Wow. Okay. See, that's next level. My hygienist, he's definitely capable of untying, retying, taking ortho records for us. But if I was like, put an open coil chain, so that I don't think he's, that dual trained. I would say that that's my one exception, is our hygienist is a little bit more to their pedo wheelhouse.
It also depends on the flow of the day. Workflow is definitely key, and minimizing patient chair time for them and for us is important. Sometimes it's best to, they broke their retainer, my hygienist will just scan them. And sometimes it's, I just clean them, they're all set, let me slide them over and have somebody else scan them. Again, it also depends time of day, what the patient, is a patient running late? Is a patient coming early? Who's in the queue and all of that. But it's looking at the big picture. And I think that's one of the nuances that really makes the difference between a well-run, co-located office and one that is not as efficient. And that could go either a straight, only one specialty versus another. It's that planning and scheduling.
How difficult, because I've spent all my career really mostly on in the ortho practice side, and most of those folks come from whatever background and they're kind of trained in the office. But have you had any issues, either of you, with like the hygienist coming from like hygiene program and then having trouble getting them to kind of do all the stuff because they kind of want to stay in the hygiene lane? Or what does that look like?
So I think it comes down to mindset, and you either I'm very willing to train. In fact, I'm happy to train because they learn it my way, which isn't necessarily the best way, but it's how it runs in our office. I'm very happy to train. But if you have someone who's like, I'm not going to do that, or I'm not going to do that, that's going to be a problem if it's not with that topic, it's going to be a problem with something else in the office.
Yeah. So what are some of the things that you're looking at in terms of mindset, or that you're like, as you're hiring people to work in this kind of unique situation?
For positive energy.
Yeah.
I'm looking for a team mentality. I never want somebody to think, well, I do more than that person, so I'm not going to do anything. I also set the tone, both doctors do, that we're not above doing anything. Today we were down 2 people in our office and I was flipping chairs. I don't think twice about it.
Love it.
And something that I want to do every day? No, but you know what? You just get in there and you go. And that's the mindset. And everybody in my office has that mindset. Awesome. And that is why it works.
It's great. That's a great point.
I actually visited a pediatric dental office and he had no RDAs. They were all hygienists, and they all had that mindset of like, we do everything because there is no one else. It's just all hygienists. And so he had fewer of them and paid them all a little bit more, that hygienist salary. But he had less assistants because I feel like they just operated at a little bit of maybe a different level. But I thought that was definitely an interesting way to do it as well.
Where do you guys look for people to hire?
Do you have the answer to that? Because
It's it's hard. I'll tell you, some of my best assistants are they happen to be women, but women who want to go to dental school, and they
Mm.
come with me. And I find summer is usually the hardest time to get employees or to find employees, and it's also when most people want to take time off. And I love summer because I have college girls who are on the dental track who come in, and I had one last year that she was my patient since she was 2, and she started in with like, okay, I'm wearing scrubs, and what's the name of all of these instruments. And by the end of the summer, she was basically running a room all by herself and was such a good assistant. She knew what I wanted before I knew what I wanted, and I was so proud of her. And I'm writing her a recommendation letter right now. Those are some of. I also think that because of culture, people, my current employees, if they know somebody, they know how tightly we work, and if they want to bring them into the family, that's great. And those referrals tend to be very helpful.
Yeah. What do you do to maintain, like, what are some high level things that you do to maintain culture? Like, is it training? Obviously mindset, but.
I think it's a mindset. I think it starts from the top. Everyone comes in, we say hello, we say goodbye, we say thank you. We talk in between patients. It's not just go in and do your work and it's cold and sterile, but I want to know you as a person. We're constantly encouraging people to, it almost sounds like the Army, like be all you can be. Like, okay, this is great. Like, who wants to learn about this? Like, what's the next thing that we can do? What's the next thing we can do, like, to better ourselves? So we never get stagnant and we never get bored. In our meetings, I will always bring forth positive reviews that we get. And I remind them that it's not just the doctor. It's from the first phone call. When you go to a doctor's office or you call, forget even before you go to a doctor's office or you go to make a hair appointment, how that person picks up the phone sets the tone. And that's really how it is. And we have, pretty strict training on how that works. And it's now at the point where my team, like my front desk, will say, oh my goodness, I had to call this doctor's office. It was horrible. I can't believe they have somebody who interacts with the public in that position because they were just so miserable. And I'm like, see, that's what we don't want to be like, And so it starts all from there. I'm constantly doing little things so I'm in New Jersey. It's been the coldest and darkest and yuckiest of winters, and there's some days that are just, we come in the dark and it's literally like we're in the salt mines, even though my office is extremely bright and cheery, as Davin has seen.
Yeah, it's great.
It's one of those days and everybody's dragging. And the next thing you know, I'm like, all right, I'm placing a Starbucks order. Here we go. And everyone's like, oh, thanks. I really needed that today. And it's little things like that, knowing when they need a little pick me up or when they need a little something. We do fun team appreciation and team building events that are a little outside of the ordinary. It's not just going for dinner. It's we've done axe throwing, which is kind of fun, but we've also done cookie decorating where we have a professional cookie maker, make the cookies and teach us how they decorate them. And at first everyone was like, what are you having me do? And by the end, like halfway through, they were like, this is so fun and so calming and so relaxing. We are an all-women office. And so one of the moms in the office has a startup bra and swimsuit store. So we decided to lift up my girls, as we called it, and we went bra shopping because it was a little treat. And everyone said, you know what, like that's something I haven't really done for myself, and they're really pretty. So I bought them, 2 bras, and they can buy anything after that. And they all would come in the next couple of days. I'm wearing one of your bras. Here we are. And it's like, a little thing. And the joke is, this is probably the only office where that wouldn't be, sexual harassment, but I was on board for it. And so just that daily thankfulness that's genuine. And, there was a day when I just wasn't feeling well, and I just turned to them and I said, I really need your help today. Like, I am dragging. I have a wicked migraine. Everything's bothering me. And I was like, I just turned to them and I just said, I need your help. And they all said to me, you never ask for help. We got you. And they really just kicked it up a level. And I just couldn't believe how wonderful they were. And I went home and I slept and was out for the night. And the next morning I just came in and said, I can't believe we got it. I got through that day, and it was nothing to do with me. It was all of you. And, think about how you want to be treated. That's really what it is. I worked somewhere else before I did my own startup, and I wanted to create a place where I wanted to come in every day and where I would want to be an employee and where I would be proud to wear that logo.
Yeah, absolutely. In talking with you, you seem very everything's well thought out. It sounds like you have particular scripting and you really thought everything through. What are strategies that you have put into place, whether it's scripting or whatever else? If say you get the phone call and they just want to be a pedo patient, how do you convert that pedo patient to an ortho patient? Or say they call and they just want an ortho consult. How do you get that conversion to where they fully become a dental home in your practice?
So that's many different angles there. Patients that start with us for peds, usually stay with us forever. And the question that I get now is, I'm turning 18. At what age do you kick me out? And I'm like, we don't kick you out unless you don't floss, and it's, they want to stay with us. And so that starts when they're young. And, so that's a very different, most of our peds patients do convert to ortho. Now, some of them do not, and that's perfectly fine. I'm very lucky. I work in an area where we have wonderful orthodontists and wonderful pediatric dentists where everybody respects the other. And if there's a family where they go to a different orthodontist and they have 4 children and the oldest one goes elsewhere, I'm very happy to work with that other orthodontist. And I do not try to convert that family. That is a sacred space, and you don't cross that line. And the same thing if they come from a pediatric office and I'm their orthodontist, I respect that. And I will actually say, you know what, maybe you should go every 3 or 4 months for cleanings. You need a little help. You should do that over there. Respect those lines. You don't need to convert every patient. And that is key.
What, this might be kind of a silly question, but if they're a pediatric patient in your office, what are some of the reasons why they wouldn't do ortho there? Is it usually relationship related, or,
Sometimes they have a relationship with an orthodontist. Oh, you know what? I went to school with this one. Or they have someone that might be a little closer to them.
Gotcha.
Where I can go to somebody 5 minutes down the way, but you're 5 minutes away, or you're 20 minutes away. That's fine, or sometimes it's insurance.
Okay. Yeah.
Yeah. We're a newer office, so we don't have the 10 years of history with patients. So usually for us, it's they maybe have an older sibling in ortho with someone else, but then they do pedo in our office. And so, I'm with you. I think the best way to convert those patients is to not have a strategy and just kind of be go where you feel comfortable, that sort of thing. Especially if they're in treatment. Absolutely never cross that line. But when it comes to the next child or something like that, even in social media posts, I'll talk about just how collaborative care is going to be better in one office, or we have dual hygiene days on ortho days so that you don't have to come in, get your wire taken out, then go see your pediatric dentist, then come back to have your wire. 3 different appointments in one day. No mom has time for that. or, their cleanings just for the next 2 years are going to be, maybe not as great because we didn't have great access. So I just, through social media, I guess, is how I strategize and educate the convenience of having it all under the same roof.
No, it's true. I would never, I don't know. I think I take more of the, there is no competition, just better your brand. There are more than enough kids to go around, and everyone's going to find the culture that's right for them. And it's all about chemistry, you know?
Yeah.
Kind of like, you're hungry. You've got an Italian restaurant, a sushi restaurant, and a burger place. Depends on what mood you're in. They're all good.
Yeah. And I feel like that's the power of social media is you can kind of plant ideas in people's head of things that they haven't thought of. I remember I had a mom be like, oh, wait, you're saying if we had a different pediatric dentist that their wire wouldn't be removed at their cleaning appointment? Moms just don't know. This is the first time they're going through braces with their child. So they don't know what they don't know. So, kind of planting a seed on social media and then letting it land where it lands, that might rethink things for their second child that's going into ortho or things like that. So, I guess that is kind of our strategy, is just kind of education and the convenience of having that co-location. I know that we talked about co-location when you were on it the very first time. So for our listeners that maybe didn't get to hear that, that's kind of what Christine has coined as the pedo ortho location, the co-location. So
do you guys have a number or a metric or a goal that you, in terms of pediatric dental patients converting into ortho? Do you guys measure that? Benchmark
Christina,
number?
I'll let you go first. If you guys, do you measure that as KPIs or anything like that, or no?
We do.
You do. And kind of where does that land?
If you're like most orthodontic and pediatric dental practices, you're probably struggling with oral hygiene compliance, observation conversions, and an increase of shoppers, especially among young patients and their families. In my practice, Wild Smiles makes converting observation and phase 1 patients easy. Young patients and their shopping families value a personalized experience. When I first added Wild Smiles to my practice, they made inventory and reordering easy, and they even led our team through simple instructions on integrating Wild Smiles into our existing systems. So we saw an immediate success. Grow your early orthodontic patient population with Wild Smiles to combat boring traditional braces and expensive phase 1 aligners. Check out wildsmilebraces.com/doctors to choose the customizable easy start kit that's right for your practice. Mention code KiDDS Biz to save 10% off your first order.
Our patients that convert to ortho patients are north of 90%.
Oh, wow. That's great. So how do you track that? Is it just with every start you go back and you're where did they originally come from? Was it an organic ortho call or was it from pedo? How do you track that?
Our patients, our Peds patients, that you're going to see them if they're in braces, right? So are they our braces or they're somebody else's braces, So how many of our patients that go for our consult convert? How many of our just new patients that are not our Peds patients come? How many did they convert? And so we track all of that. And then the ones that didn't convert, why didn't they convert? Did they decide to not seek treatment? Did they decide to go elsewhere? As long as their teeth are getting what's right, that's all that I care about.
Yeah. Let's get into KPIs for a second, because I feel like, I'm first and foremost an orthodontist. So, especially when I think of the business side, and it comes to KPIs, our ortho KPIs are so much longer. And then pedo's this version of just what I think is, good. But I'm so interested to hear from someone that's dual trained and has been practicing a lot longer than I am. What are your pedo KPIs that you track and have really felt is the most value in your practice?
Number of new patients a month.
Mm-hmm.
That's one thing. After that, it's where they come from. Was it a referral from the pediatrician? Was it a sibling referral, or was it from an internal referral? Did it come from a parent? Now, that's kind of a loaded question, and it's also not always accurate, because it may have been that the pediatrician gave them 5 names and and then they asked their friends who sent you. So was it the pediatrician, or was it their friends? Or if it's a sibling, that's the most straightforward of them all. But that's kind of, you don't always know. And you say
Right.
that like 1,000 impressions for somebody to remember a brand, and so is it that they heard it all around, they saw our marketing, they saw me somewhere, or they read about us in an article, or they heard a friend, or then they saw it from a doctor. It's all those things of that name recognition. They've driven by our sign. They've seen, we do these, my office is on Main Street, and we are 3 doors down from the junior school or the middle school, but everything runs through that street, and we have a little lawn in front. So we do those big, like, card your yard, like those big, like 3-foot signs in front at different times. A lot of times they say, I saw your office and your signs. They always made me smile, and you don't know what it was that was that last reason that they come, but we try to ask. Or they may say, a friend which friend? We'd love to thank them. And they'll say, oh my gosh, it's all of my school that comes here. Or like, I don't even know which name to give you. Like, literally.
We get the neighborhood a lot.
All of my friends.
The neighborhood.
Have to go smile, yeah.
Yeah. Sometimes it's hard to really pinpoint. I feel like in our scripting for the new patient call, I get it there. And if I don't like the answer, then I'll ask again in person to try to like nail it down. Cause I'm just so, I'm a weird about keeping track of KPIs. Cause really, that is like, to me, the most important question is, where did you learn about us? Because that is where I want to put my marketing dollars, or that is where I want to, put more ROI. So
I find that when you ask that question on the phone, you may not get as much of an answer as at the end of your first appointment. It was such a pleasure meeting you. Thank you for joining our office. We're always here. How did you hear about us?
Yeah.
At that point, you've started talking. You've made that connection. And they feel more at ease. And I find you get more information then.
Absolutely.
Well,
Or even a follow-up, because you may get the pediatrician and then you may get the friend. So you'll hear it's multiple places.
And like, what is your goal? Because again, I'm asking from a point that I just do not know. What is like your goal of like new patients per month? Like, you're an established office. I'm more in my growth phase. I don't
decreasing. You never want to be decreasing. So each month, like whatever we had last month, we want to add more. And that's
Okay.
how.
Okay. Yeah. My front desk last week was like, I think we're going to have to get a call center. And I kind of laughed. I'm like, we're one office. Why do we need a call center? You are the call center, And she's like, we had 55 new patients this week. She's like, I was not on the phone with a new patient. Like, all of our active patients are going to voicemail. And like, she's just like, I'm like getting overwhelmed with the new patient calls. So, I mean, that was great for me to hear. But yeah, sometimes
So
I don't know. I'm like, is at what point do you start thinking a year into the next of like, okay, we're outgrowing our space too,
Well, I'm going to tell you, it may not necessarily, it's about being efficient with your space, and it may be time to bring in somebody else at the front desk.
Yeah. For us, because it's a lot of pedo new patients. And so right now everyone has a 45-minute appointment, and I'm like, okay, how do we just be more efficient with our time? And I'm like, okay, we're having a recall that's under 3, because those are 30 minutes. It's 15 minutes saved there. And then we're doing a recall with no x-rays. That's another 15 minutes saved. So just trying to be more efficient with our schedule, because it's not like we're outgrown our space. I just feel like we don't have enough staff, and hiring is just an issue.
Yeah. So that gets into scheduling.
Yes.
And under the age of 3, you cannot keep a child under 3-year-old for 45 minutes.
Right.
And in fact, I had one mother say to me, I so appreciate how efficient you are, because it's rude to have a under 3-year-old for 45 minutes in an office. It's like not rude for them to me, but for the parent of the 3-year-old is being rude to the office. It was very interesting the way they said it.
But then is there a threshold of like, okay, that was too quick of an appointment? Because then I get self-conscious of like, oh, did they find enough value because we didn't get a lot done? Like they didn't get the prophy, or they didn't, obviously we're not taking x-rays. Like, is there also like a minimum minute that you're like, oh, like that was too quick?
So I think it is delivery.
Mm-hmm.
For one. Number 2, we always get a cleaning in. Number 3, it's education. It's anticipatory guidance. It's not always the amount of time, but the amount of knowledge and how it's presented and how they feel. Talking to them about why it's necessary to brush, or fluoride versus not fluoride toothpaste, or what questions do you have? Or can you just show me how to brush? I feel like I know how to brush my teeth, but they keep telling me to brush my child's teeth, but I don't know how to brush my child's teeth. And I feel like I should know how to brush my child's teeth. Well, let me show you, and even if it's just that, it's a win, and we get in there and we talk about everything. And we also give out printed information too, because sometimes they're like, oh, I just wish I could share this with my friend, here you go. Or, oh, my husband doesn't believe me when I tell them that. Okay, well, here, take this home. Or it's my in-laws or my mother, because sometimes or my caretaker, because it's not always the parent that's with the child all day long. It might be a grandparent. It might be a different caretaker, an unrelated caretaker. So it's providing information and education and making the time valuable. I think that keeping someone for a long period of time where it's not just to spend time is not always the wisest thing. And
what topics? Oh, go ahead.
Appointments.
Yeah. What topics do you have ready to go in handouts? Because I definitely think that's super valuable. So I'm just curious, like, what do you have on hand that's ready to go in handout format?
We have ones from the Academy and from the ADA. So we talk about trauma. We talk about finger habits or pacifier habits. We talk about sealants. We talk about snacking.
Love that.
So
it's maybe not like a handout that you formulated. It's maybe like from the AAPD.
Mm-hmm.
Okay, got it.
So in building a super efficient schedule, what are some specific unique things for like the co-located practice?
Yes.
That are in your schedule or in your template that might not be there if it's just a Peds practice or just an ortho practice.
It's doctor time. And I think this doesn't necessarily have to be from co-location, but if you think about just a Peds practice, you have to know if you're doing like a deep operative and then you have multiple hygiene checks right next to you, you have to know when do you start a patient on the hygiene, or do you finish with them, or how you're going to get that flow, because you're not just going to be one column, you're going to be multiple columns. So that's the first thing. Know when the doctor needs to be in each place and value that. And also knowing that, so most people are not dual trained, and I do juggle the Peds and the ortho simultaneously. So they will know, don't put an operative right across from a full bonding, right across from a new patient exam. Like I can't do all those, I can't be in all those spots in 30 minutes. So they'll know I can pop in and start an ortho adjustment and then go and see my operative and then pop back out. But I could place some brackets, go to my operative, and then they can finish it.
You're definitely very unique in where like you as a provider are doing
everything
both. Right. I think for like the majority of offices, it's going to be like an orthodontist paired with like a pediatric dentist, and it's
But
like kind of coordinating the
so
two people.
well, I would say that having the orthodontist available to pop in for hygiene, not to do the hygiene checks, but to be like, oh, I have a question. Do you think this would be a great time to start? Would you like to see them now, or would you like to see them in 6 months from now? Or even, have you met our orthodontist? You know, let me introduce you. And their little head pops in just to wave, so that child even knows who it is they're looking at. You know, you said that you work opposite days, so they may know who it is. They'll know the pictures, they'll know the office, they'll know the employees, but they may not know the doctor. It's always good to see the doctor's face.
Absolutely.
Is your associate, Dr. Carter, a dual trained as well?
She's a pediatric dentist.
Okay. Has there ever been a time where you're like, I need to replicate myself and I need another like dual trained?
Always.
Yeah.
You know, I think that, yes, but I don't think that that's the easiest thing to find. And so I think it would be totally fine having an orthodontist and a pediatric dentist, but still getting into working together in our system.
I find, and I would love to hear your feedback on kind of what we're doing, because for us, it's 2 separate days. The ortho's pretty like general to ortho. But for me, it's like, how am I optimizing the pedo to kind of fit that co-location, like doing our ops program on pedo days. For me, I'm like, I would love to do adjustments on pedo days, but then I'm not there. So yeah, it's just kind of hard. I haven't mastered or figured out a great templated system.
So the thing would be, they could have a cleaning and then they can pop right over to ortho, right afterwards.
Right. I guess the issue is if you don't have big enough space where you're both doing them on the same day, it's a lot more virtual. So like our whole ops program is virtual. So like for our schedule, go ahead.
How many chairs do you have?
We have 5 in the open bay. So we were scheduling on the hour, 45 minutes. And then that was leaving 15 minutes for same day SDF, same day sealants, or ortho records, or if they were in our ops program already, to take new updated records. And I did like that because it gave the opportunity, again, for convenience of like adding in treatment, adding in ortho and not bringing them back, and then me being able to do a virtual consult. But then it runs into this problem of we have all these new patients and I don't know how to maximize our schedule to where we aren't having some 15-minute slots that are just left open.
You could even run every half hour and stagger them, or 45 minutes. And if you're having 4 columns, they start at different times, on the hour, 15, or on the hour, and then at the half hour, and then you'll have staggers. And then that's what I mean about doctor time, where you're going back, like as you're finishing with one, then you're going to the next, then you're going to the next in a zigzag, as opposed to everybody needing you at the same time. So I do not agree 100% with everything on the hour and 45 minutes, because then you're limited to a 3:00 appointment, a 4:00 appointment, and you're not being efficient.
Yeah. Do you have? Oh, good.
It was have your front desk play Tetris, and you will learn how to get those pieces to fit together better. And I kind of laughed at first. I was like, Tetris, but if you think about it, it's training your eye to fill voids and to get spots in it. And it's no different than looking at a color-coded dental schedule. And so, if I need 15 minutes, can I slip it there? And then that will fill this one. And it will, but you have to look across and see where your doctor time is, and having those rotation, and not everybody starting on the hour can actually be much more efficient. Even if you have the same family, let's say you have 3 siblings and 2 of them start at 3, but one starts at 3:15, they're going to show up at the same time, which is fine. Wait for that little bit. We're not saying they're waiting 45 minutes, but then it allows you to have somebody else above and below and on the side. And so it really works much better.
Do you have an assistant that kind of is like the quarterback in the back, where they're saying, you get out of the treatment room and you're like, where do I go? And they don't run a column, but they are just directing you on where you need to be efficiently.
Yes and no. So what will happen is sometimes Laura from my office manager will come and kind of point me. But oftentimes, as I'm finishing in one chair, they will say, next step, you need to go to Ortho 3. Ruby needs you. And then that person will say, okay, the next person is Lori needs you in Hygiene 3. And then after Hygiene 3, you go to Hygiene 2, and then you flip back over. So my whole team is aware of where everybody needs to be. And they also will come and they'll say, if there's a hygiene check, if someone will come for me, sometimes Ortho will say, you know what, she's caught up, go get Dr. Eva, so it's like the whole office knows where everybody's needed. And that's where teamwork really comes in.
Yeah. It just takes time to get that synergy between everyone.
Exactly. And when I say they know where I need to be before I know where I need to be, it's the truth. And then like we had a day last week where we had the flu run through the state of New Jersey.
Oh, yeah.
And had like a 50% sickness cancellation rate. And I was more confused on that day where to go because it was a slower pace.
Yeah.
Like, wait, I don't need to be in 5 spots. I'm okay.
Right.
All right.
Is there any other unique KPIs that you track either for pedo or for ortho, or kind of seem like tracking them together?
So we check who has not been seen in over a year.
Okay.
We want people are not falling through the cracks.
Yeah.
And we call them because maybe we do it at 6 months and at a year because we want to make sure they're there for their recalls. Have they moved away? Did something happen? Or the parents like, oh my goodness, I had an appointment and I canceled. And then I said I would call back. And we want to make sure that. We also want to make sure they're not leaving. It's not always how many eggs are coming in the carton, but how many eggs are being used.
Absolutely.
Want to make sure right now you're not necessarily seeing that part of it, but you want to see who's aging out, who's moving away.
Yeah.
I live in an area, where we are a commuter to New York. There are a lot of people that have been transferred or jobs have changed or lost, and they move away, transferred. And you want to make sure that we're keeping that clean too. And it's also, if we have this amount of attrition, what are the reasons?
Right.
Is it an internal problem or is it an external problem? I can't control parents moving jobs or just south, but I can control if they're going, or try to control why, or figure out why they're going to a different office.
Are there any KPIs that you track to measure your associates' performance other than their production?
Well, we check failure rate on restorations, which it's very, very low. And sometimes brackets break or, restorations fail. But we are checking that.
Yeah. I would say.
And in appointments, like, are parents happy to be seen by them? Or are they saying, no, I'd rather. Everyone has a preference with the doctor, right. But is it a consistent thing?
How do you organize the KPIs? So like in our business, we call it a scorecard, and and everybody is responsible for owning certain numbers and putting them into the scorecard. And we do that weekly. We update the scorecard weekly, and then we review it as a team quarterly. And so it's like, how do you organize these KPIs and how often do you review them with the team?
So every day, our schedule, we have a sticker that goes on the bottom and it has all those numbers: new patients, missed appointments, cancellations, rescheduled appointments, no shows. I think last year we had, in the whole calendar year, we had 15 no shows.
Wow, that's
very amazing.
Few.
But we had cancellations, reschedules, that's different. But the no show is really, really low. And those are the types of things that we're tracking, and so we track it every day. Then it goes into Google spreadsheet, and then we see graphs at the end of the month. And then my executive committee, which is me, my office manager, and my head of the clinic, sit down or the clinical side, sit down every month and we review it. And then we go over it with our team. Not every month.
Why do you think your no-shows are so low?
Well, we have reminders. We use Weave as our program.
Us too.
Have reminders, and we will call them if they're not there 10 minutes late, and they'll either say, "Oh my gosh, I forgot. Let me reschedule right now." But I also think they know it's getting that optimum time appointment. Like, we're a hot spot, and if you know you can't get in really easily, if I can just get in the next week, oh, I'm not going to go today, I can just get in next week. We don't punish them. We're just busy.
Right. Do you charge a no-show fee?
We do not. If we see a pattern, we will send a letter saying that there will be a fee at that point, but they are notified before that, and they have to be real offenders. You kind of know who's going to show, who's going to not show. You know who's going to show up late, who's not going to show up late. I had one parent who they were 10 minutes late, and I said to my team, call. Not because of the appointment, but that parent is never late, and I was genuinely concerned that something, like, your people.
Yeah, we had to start charging a $50 no-show fee just because our schedule is so packed, and I'm type A, I oversee everything. So I would see on the voicemails that were left, like, oh, I realized we had another doctor's appointment that same day. And I'm like, okay, if I don't show up to Pilates, they charge me, So I'm like, we're going to start charging. And we're also to the point where you can't reschedule. So, and what I hated is that we're telling people that you can't get an op appointment for the next 3 months. But then same day, 2 people will cancel. That was infuriating me. And so it's been greatly better since we just do a text to pay through Weave. And I feel like we haven't gotten a lot of backlash. I was really worried about how people were going to perceive that. But I feel like it's just so standard nowadays. I just feel like if I miss an appointment, there's going to be a no-show fee.
How do you guys handle no shows for new patient appointments? Same way?
Obviously we don't charge for those.
Or I know some practices that have a hard time with they've got a handful of people every month that are new patients that will either no show or cancel last minute, but they want to reschedule. And so they might have a couple of times where they do that. And then do you charge them a fee? Do you just let them go? What do you guys do?
For first time, for anyone that's a patient of record, we don't charge them on their first offense. Or if they say that they're sick, because we don't want sick kids in our practice. I don't want to get sick. We don't want to. So if they're sick, or if it's their first time offense, they don't get charged. Or it's a new patient exam. Because obviously, that would leave a salty taste in my mouth if I was the patient. So yeah, we try to get them back on the schedule as soon as possible.
Dr. Carter, what about you?
I know an office in Arizona where they overbook their new patient exams because they know 50% aren't coming. And
50%? Oh, wow.
That aren't coming. And I think we kind of value our appointment. Everybody where I am is very, very busy. I think everybody everywhere is very, very busy. And, we kind of say, okay, we've reserved an hour of time for you. And if you need to change it, please let us know. But then if they don't show, we, brand new, we may or may not. Let's put it this way. In the list of things that my team needs to get done, that calling them to reschedule might be a little bit lower on the list.
Right.
Right. We'll let them know that they missed an appointment, but we're not necessarily going to hunt them down.
So you guys both have really busy practices, and, there's this patient, like you guys were talking about, the patients kind of understand, if I don't show up, there's a chance that I'm not going to get in for a while. If I'm a growing practice, and I don't have that scheduling issue, but I kind of want patients to take it seriously, what are some barriers or kind of artificial barriers or ways that those growing practices can kind of have the illusion that they're busier than they are? Or do you even recommend that that's a strategy?
I think it depends how it's done. If you're a growing practice, first of all, you don't want to do harm to the child. You want what is best for the patient. So that's the first thing. So let's say they miss the appointment, or you call them up and we'll say, we missed an appointment. We had time set aside for you. I'm really sorry. I'd like to reschedule. It may not be the next day. It may be a week later or 2 weeks later, but it may not be the next day. Now, at the same time, it can also be, you're actually very lucky because we did have a cancellation and an opening for tomorrow. Ordinarily, it takes longer than that to get in. However, it seems like the stars are aligning and we have an opening. Please do not miss this appointment because at that point there will be a charge. Time is valuable.
I definitely think it's been hard on my patients because, we were a startup 3 years ago. 3 years ago, you could get a 4:00 any day of the week you wanted, And so I think it has been hard for my patients that are like my OGs. And now all of a sudden, if something comes up or they don't schedule immediately when they leave, they're not getting their appointment times when they want. And they're definitely feeling a certain way about that. So I definitely think that it's very smart as a startup to be a little bit strategic and not allow your patients to get too comfortable with rescheduling or having a certain appointment time, because it has been a struggle the minute that we flipped to where we're no longer a startup and we are at capacity. Cause the patients don't see that as a great thing. I see that as a great thing. But they're like, I love the days when I could call and get in same day, and that it doesn't happen now. So I definitely think that there's a little bit of psychology from the beginning so they don't get too used to being so available.
Yeah.
I also task my front desk to schedule patients when they leave, because then it's in their book and you know what? I don't know, I'll call. Okay, well, it's always good to have something in at the time that is your ideal time, because, our schedule does fill up and we want to respect your ideal time as much as possible. And I think that kind of changes the mindset. Do it now because it's beneficial for you.
Yeah.
It benefits us, but why is it beneficial to you? And I would start that from day one. I did start that from day one.
I think it's really important. I think that's a great point, that you should always frame things in why it's beneficial for the patient. Even if it is beneficial for you, I think framing it so that they understand why it benefits them and you get more buy-in that way.
Absolutely.
I think that's the trend of tonight, of our conversation, where we said, what's the best way to find value in a shorter appointment? Make sure that there is value and that they feel that way. And even this with making appointments, it's how we phrase things. And it's not in a snake oil way. It really is really beneficial to everybody to do it early and at the time that's best for your patient. Everybody wins. Yes, things change, but making sure that is the culture of, we are here to help you, but we need your help to help us help you.
Yeah. Yeah. Okay. So before, I want to move on because I want to make sure that we talk about budgeting and ordering for a co-located practice. And I know those are can be really big topics. But when it comes to your practice as a co-located, you're doing both there, what are the unique budget items? And let's just maybe focus to start on, what are the things that you do that are different because you're co-located than if you were a standalone ortho or Peds on the budgeting side? Let's start with budgeting.
So, oh, wow, this could be like a 3-hour course right there. So when you bundle, you have buying power.
Okay.
So that is one big pro for doing things together. Now, you can create an umbrella company and then have ordering for the two separate sides. Now obviously brackets are very different than composite, or sealants. So there are certain things that are definitely in separate columns. But when it comes to tray covers and air water syringes and cotton rolls and gauze and varnish and things like that, it's really pretty much the same, right? So kind of pooling that in its own way makes it beneficial, because you will drop, the price of your prophy head from 75 cents to 48 cents to 27 cents, and that makes a big difference just on volume. So, there are multiple ways to do it under one umbrella, and then kind of keep track of who's ordering what. It's the same thing with your front desk. They're picking up the phone for both. You have one telephone number. Well, are you paying 50% of their salary? Are you paying 50%? So it has to be divvied up. And then, you see how much production is ortho and how much production is peds. And then at a certain point, at the beginning, it's heavier on the ped side, but then at a certain point, it gets to be equal. And then at a certain point, maybe one pulls ahead, and maybe that's how you divide some of the things. Or maybe it's just that they're common costs. You put money in the pot, you pay all of that, and then the profit you divide based off of production. So everybody has their own dance. Everybody has their own formula. It depends on the players. It depends on so many different things. But it's definitely beneficial to pool for marketing, because you're not just one half of it. It's synergy. If one comes in the door, it's going to help the other side. So marketing is absolutely IT, equipment, all of that stuff. I always say disposables. I'm not going to care if I use 30, if one side uses 45% and one side uses 50% of cotton rolls. We're all using cotton rolls. I don't want to count cotton rolls. Like, to me, it's not worth it.
For your practice, how do you do it? Because for us, I have wanted to dissect, and I just can't figure out how to do it. It just seems so daunting. So for us, it's just been one big budget for SoCo, and then the ordering has one budget, just because there's so many, like you said, the disposables. I don't even know how to separate that into two different accounts, and yeah, it just gets so complicated. So do you just say screw it, and and it's just one ordering, and ordering has a monthly budget or a weekly, whatever you guys do? Am I doing that wrong? How do you do it?
I mean, how do I say this? It's not that we don't budget, but you can't make money if you don't have the supplies.
Absolutely.
So I'm not going to say, no, I'm not going to order that, those brackets or that composite, because we've hit our budget this month.
Right.
So that type of thing. That being said, I try to, it's like air and a spare. You have everything and you always have a backup, but I don't have 6 backups of things.
Right.
You never want to run out. Everybody knows the one thing that will really, I'm pretty calm, but the one thing that will tick me off is I run out of supplies. If I run out of supplies, I cannot provide quality care,
Right.
No, same. Because I don't get mad. I'm like, yeah, we have a budget, but then if we go over, we go over. I mean, we need what we need.
Right.
So who is your vendor that you primarily use for everything?
I use a local vendor. It's called Newark Dental.
Oh, interesting. Okay. So when you're putting together that master order list, it's just one order list, right? You don't have 2 accounts, one ortho, one pedo. It's just one order account.
Correct. It's one list. One company. Mm-hmm.
Yeah.
Do you keep track of supplies on three lists, like a ortho only, a peds only, and then a shared item?
We do.
Okay.
Mm-hmm.
Gotcha.
We do. The thing is, okay, so that's where I do primarily mine, but we're always checking at what the numbers are at Shine, what the numbers are here, because I don't care who your supplier is, they'll change your price tag on you. They just automatic. And that's one of the things that we do. We always check every 6 months. We're checking, or periodically we'll check. And sometimes places will have specials. Why should I pay more?
Yeah.
So I have a question on this, because I have seen in my 18 years in the business, doctors that are picking up pennies, watching dollars go right over their head.
Yes and no.
Yes and no. Yes. So what are the things that you're like, no, I'm going to like, how do you determine what you're going to shop around and get deals on, and what things you're like, I don't really care what it costs. I'm going to do it because it benefits the patient, or it benefits my, the vibe that I have, my brand. Yeah. So what are those things?
Yeah. I use high quality materials, my composites, my brackets, all of that stuff. I don't want like cheap ties that are going to break on me. That stuff I'm not cheap on. You know what I'm cheap on? Cotton rolls, gauze, suction. We go through that like no one's business. If I can get less for the sterilization bags, that's the stuff that I'm like, they're running a special on that, order it from them this month. And that's the stuff that I'm like, we blow through that stuff. We have storage downstairs. That's the lowest rate I've seen forever. Let's order a 4-month supply downstairs right now. That's the type of stuff. But I'm not going to use one composite over another composite to save pennies, because if I don't like that, or even the brackets, you and I both know, whatever bracket, they have different pros and cons. You've got to use what you like. And that's the stuff I won't go cheap on.
Yeah,
absolutely.
Yeah.
And I'm a little bit silly, but I'm very aesthetic. Like, we only use black gloves. Our air water syringes and all of our tips are only white. Like, we're very, on brand with everything. So yeah, I'm willing to spend a little bit more on black gloves, but, I'm with you. Other sterilization or, there's some disposables that I care about.
Right. Yeah. Yeah. Well, true. Like, we did get gauze once that was like horrible. And I was like, who gave us that?
Yeah. Yeah.
And it was actually, they shipped the wrong one. And I was like very happy to hear that it wasn't one of us. But you know what? This is where I lean on my team, because I'm not looking at it all the time. They come to me and they're like, oh, this went up in price, or this, or I have a special on this. They know. And I always say, when you order, think of it as your own money. Yeah. The other thing is we play Price is Right, dental Price is Right, every so often in our office meetings. And I was like, all right, how much do you think this costs? And everyone will say something. I'm like, nope, this is how much it is. And everyone's like, wow, I had no idea. And that is a really fun way to convey your overhead.
Yeah.
I love that idea, because so many times the team has no clue what stuff costs. And that's a great idea. I love it.
And it comes across, it's fun. And like, if you get it right, you get a little, you get a cookie, or like you get this or you get that, as opposed to, do you know how much this is? Why are you not taking care of it? And it sticks in their head and they all go, wow, I had no idea. And so, people are a lot more willing to go look for a handpiece that may have fallen in the garbage when they know how much they are, as opposed to, oh, it's just a handpiece.
Right.
Not handpiece is thrown out, but I'm just using as an example. I do hear that from other practices. Oh, they lost a handpiece,
Well, you touched on marketing as like, obviously can't be divvied out pedo ortho because it's, one brand. Totally agree with that. That's how we do it. But is there any like specifics that you do for your practice that are really targeting, the younger kids for pediatrics, and it's more so targeting the adolescents for ortho? Or is it all just completely one strategy?
I think it's they're different envelopes, as I like to call it. Each one is very valuable. And, maybe you won't catch them when they're for their Peds patient, but then they've seen your name a bunch of times, or you've sponsored this team, or you donated to that, or you supported this group, or they saw you over here, and they'll say, you know what, I remember you, and I'll go there for my braces, And so it's really, like I said, it's 1,000 impressions before they remember you. And it's kind of you don't want to be just everywhere. And I tend to stick to things that mean a lot to me. If my patients come to me and say, I'm in a play, how am I going to say no to somebody?
Right.
Those are the things where even my front team is always like, okay, enough. We've hit our budgeting. We've hit our budget for this for the year. I'm like, how are you supposed to say no to that girl who has her little play? And they're like, yeah, you're right. And parents remember that, but more importantly, the child remembers that.
Yeah.
In fact, I had like a middle school play come in, and they were like, Dr. Carter, we saw Carter's smile in there, and you said thank you to everybody performing, in your little thing. It wasn't an expensive thing, but it made a difference to those kids.
Yeah.
And she actually said, nobody else's dentist was in there, just so you know. Like
they got your back. They've got your back.
That's great. I feel like it's the opposite where I'm at. All those things, I feel like I have to be coming up with things so out of the box, because every orthodontist and every pediatric dentist is in the school. Their banners up on the things. It's like, okay, it's almost become like expected, to where I'm like, what can I possibly do that is something different? Because this is just, it's almost become like the norm. Like, of course, the orthodontist is going to sponsor the little league. And if he doesn't go, it's just like, we obviously do those things because I think that every single thing adds up to the pile. But on the pediatric side, something that I haven't heard anyone do is we created a coloring book of what to expect at SoCo on your very first appointment. And our dog Peanut is the mascot. And so it's like Peanut walking through, and it's a coloring book. And when they call for a new patient, we mail that in the mail with SoCo branded crayons. And I'm just like, see, that's a touch point that they're going to keep their appointment. And I don't know of any other dental office or that's sending them a coloring book telling them what to expect at their first appointment. So are there any things like that you're doing in your office that's like out of the box?
So you just said that you go to a Pilates studio, right?
Yes. Okay. When I'm pregnant.
But so when somebody there announces that they're pregnant, they should get a little gift from SoCo. So they're thinking about their child's teeth before they even started.
Love that.
So we do a little bib that has our logo on it.
Mm-hmm.
Have toothbrush and toothpaste for mom, because moms, when they're pregnant, have a lot of reflux, and sometimes their chemistry of their saliva changes, and they're at a higher risk of getting cavities. Yes, the old tale of every child you lose a tooth. We don't want that, but it's true. Yeah. And it's all these different things where they're up at night or doing this, and they're, sipping more coffee or something with sugar to keep them going, and to remind them to take care of them. And then also remember that maternal dental health is definitively reflective of your child's dental health. So
absolutely,
because once you become pregnant, they forget about you. It's all about the baby.
Yeah. We're actually going to be rolling out prenatal visits with like salivary testing, a bunch of education. So that's coming up. So I love that. Where do you actually get the bibs made?
I don't know. I think it's on, gosh, I have to get that to you. We have a standard order that we get all the time. It's one of those like Marco products or Alibaba or one of like
we'll email you, and then we could add it to like the show notes for people. So are you giving those out at like when the mom is pregnant in your office, or are you actually like partnering with other businesses and they're giving it out to their pregnant customers?
Both.
Love that.
In fact, we even have a nail file that's actually not because it's mine, but it's like the best nail file. It's like by nailfile.com or something with our logo in it. And it's the best for parents because it's just in your bag and it has a sheath on it, so it protects. But it's the best for filing children's nails.
Oh, okay. We're going to need that link too.
It have a sharp thing on your Essex retainer or on your Invisalign.
Yeah.
Glue that out.
Yeah. Well, Dr. Carter, I mean, you are so awesome to share all these ideas and be so open and transparent. We're going to have you back. I mean, this is just we're going to have to create a series, I think.
Like the not co-host, but like, guest.
Yeah.
Exactly.
We'll have you as our featured guest.
I can be Pete, the little mascot.
Yeah.
Yes.
Well,
oh my gosh.
You're a wealth of knowledge, obviously, with all of your experiences, but also you're just so great to be willing to share with our audience. And I think everybody who's listened to this will get just a ton of like takeaway actionable items. So thank you so much for being on and giving so much of your evening to us.
Yes.
I know this isn't, it's not easy for you to find time, so we appreciate it.
Yes, very much appreciative.
Yeah. Well, for everybody who's listening, if you want to join the KiDDS Biz community, we've got a Facebook page that is becoming more and more active, and we share. Dr. Ashley and Dr. Carter have both shared some kind of insider knowledge from their practices on that. So join that. And Dr. Ashley, what else am I missing?
No, that's it. Well, actually, if you want to find more stuff, why don't you tell them about phase 1 for like the co-location? Don't you have some courses coming up, Davin?
Yeah, absolutely. So we've got some courses. Actually, all three of us will be a part of that, and we've got more people involved as well. But if you are a pediatric dental practice thinking about bringing on an orthodontist or an orthodontist looking at focusing on phase 1 as a way to grow, we've got some phase 1 building a phase 1 program in your practice.
Interceptive orthodontic program. What is phase 1? It is interceptive.
Sorry,
Parents
yes.
don't know what it is.
Thank you. Yes, I think the actual is we took your advice, and it's an early interceptive treatment course is what it's called. I get bogged down in the old school lingo. Yeah. So there's some information in the show notes that people can check out online. The first course is going to be in June in Omaha during College World Series. Then we've got another course actually in Dr. Carter's office that'll be in October, and then Dr. Ashley's office will be one of the locations as well.
Yeah, and Christina and I will be lecturing. So if you guys do feel like for our audience that they pick up things from us, that's another reason to hear more in-depth topics about the co-location in phase 1.
Yeah, it's great. It's going to be great. I mean, it's everything you need to know to start an early interceptive treatment program in your practice. Did I get it right, Dr. Carter?
Yes, you did. Beautifully.
Right. Thank you. Thank you guys. What a great show. I love this one. Thank you.
Thank you.
Are you looking to grow practice revenue, improve patient retention, and enhance overall practice success in 2025? Join our faculty of leading practitioners, all experts in the crossover of orthodontics and pediatric dentistry, at one of 3 hands-on courses designed to equip orthodontist and pediatric dentist with essential knowledge and tools to establish and implement a successful phase 1 bracket program to keep more patients in-house and grow your practice. Participants will be given a comprehensive roadmap to build a robust early treatment program and will be able to apply these strategies to their practice immediately. Whether you're looking to implement an early orthodontic treatment program for the first time or enhance your current offerings, this course provides the tools and knowledge to help you grow your practice and provide top quality care for younger patients. For more information on locations and dates, and to sign up, visit specialtyappliances.com/course/registration. Registration is open, and these in-office courses have limited space that will fill fast. So more information can be found again at specialtyappliances.com/course/registration.
Thank you for listening to the KiDDS Biz Podcast. We hope you gained valuable insights to elevate your practice. If you enjoyed the episode, please take a moment to leave us a review. It really helps us grow. Want to dive deeper into our community? Join the KiDDS Biz Facebook group for discussions, resources, and networking with fellow professionals. Until next time, keep striving for success in your ortho and pediatric practice.